I'm going to talk about 3 categories of foods that are bad for your teeth. So the first is the sugary foods like candies, toffees, chocolates, cakes, and if you have lots of tea throughout the day and putting 2 teaspoons of sugar in it. So these are really bad and they cause tooth decay, and what you would need to do is to cut down on the frequency of the sugar intake, because it is the frequency that causes the damage, not the amount. So you can have, say, a box of chocolates on a Sunday and brush straight away, so long as the rest of the week you're having a healthy, balanced diet. Number 2 is the acidic drinks, sports drinks, fizzy drinks, and the citrus fruit juice drinks. These can actually soften the enamel, and then what happens is if you're brushing straight away, then you're brushing away that softened enamel. So that is erosion and abrasion of the enamel. And what you would need to do is to cut back on these drinks, but obviously if it's healthy fruit juices, then have them with a straw, but don't brush straight away. Wait 20 minutes for the pH of the saliva to neutralize again, and then brush with a fluoride toothpaste. And number 3 is the food and drinks that actually cause staining, like black tea, black coffee, curries, red wine. So what you would need to do is to cut down on these sort of foods and drinks. And then you can have, once it is stained, then you can have a scale and polish at the dentist or a hygienist, or you can take it a level higher and have tooth whitening. Now, tooth whitening can be done in 2 forms at the dentist. So one can be the home professional whitening. So the dentist will take impressions of your teeth, so imprints of your teeth, send it off to the technician in the laboratory, and they make custom-made bleaching trays for your teeth. And then they give you the bleaching agent, the bleaching gel that you put inside the tray, and you wear it for a couple of hours every evening. Now what they do is they take start pictures of the shade of your teeth, and then they will review you periodically to make sure that you're going in the right direction and achieving the shade that you wish to achieve, and that there are no side effects like sensitivity. So they will monitor you throughout. Now during the process of wearing it, if a little bit of gel sort of oozes onto the gum, you must wipe it away with some cotton wool or tissue so that it doesn't damage the gum. The second one is the professional whitening, which is done at the chair side, or called the power whitening. So what the dentist would do is retract your cheeks and your lips. So this is going to take a little bit longer because they have to put a stronger gel over the enamel of your teeth, and then they zap it with the light, and then they may also supplement this with the home professional whitening. So the advantage of doing all this at the dentist is that they will monitor you and make sure that you're not getting sensitivity and no side effects and no gum damage. So basically cut down on the frequency of the sugar intake, reduce the acidic drinks or take them with a straw and don't brush straight away, cut back on those food and drinks that cause staining, and keep up with all your dental appointments. So I hope that helps, and bon appetit!